Hi guys, welcome to my channel. Before we get started, make sure to hit that like button and also subscribe to my channel. Healthcare trends to watch in 2023. So make sure to watch the full video. Most facets of modern life, including entertainment, commerce, and healthcare, are being impacted by big data and machine learning. Google is aware of the ailments and symptoms people are searching for, just as Google is aware of which products individuals prefer to buy when on Amazon. All of this information is useful for very specific personal profiling, which has the ability to forecast healthcare trends as well as be very valuable for understanding and targeting behavioral patterns. There is a lot of hope that the application of artificial intelligence, AI, would significantly enhance all aspects of healthcare, from diagnosis to therapy. The prevailing consensus is that artificial intelligence, AI, tools will support and improve human work rather than, as some have suggested, completely replacing it. AI is prepared to help medical professionals with a range of duties, including administrative workflow, clinical documentation, patient outreach, and specialist support like image analysis, medical device automation, and patient monitoring. In 2023, provider organizations, commercial payers, and government programs will continue to look for ways to enhance health outcomes while cutting costs, which will lead to a continued shift in the healthcare industry toward value-based compensation models. Networks must digitize unstructured data, create a 360-degree longitudinal healthcare record (LHR) for the patient, and enable permission data sharing in order to implement value-based care (VBC) in the coming year and beyond. In a VBC model, payments and other procedures are required to support the many-to-many stakeholder connections between providers, payers, and community-based organizations (CBOs). In 2023, keep an eye out for a few of the broad trends listed below. 6. The patient is given care. Whether it's in a retail setting, a house, or somewhere else in the neighborhood, we'll see a proliferation of alternative care delivery places in the coming year. More care locations in retail settings will open, offering primary care and other services like vaccinations, testing and screening for viruses, infections, and pregnancies, as well as treatment for minor illnesses, injuries, and skin conditions. Major pharmaceutical chains like CVS and Walgreens, as well as big-box retailers like Walmart, will also expand their retail locations. As more patients and healthcare professionals understand the need of ambulatory care, there will be less focus placed on care in traditional locations like a doctor's office or hospital. In terms of where individuals can get it, the delivery of care is in some ways emulating retail. By enhancing care access for vulnerable groups like the elderly, the homebound, and patients in rural places, this trend will contribute to a better health equality. 5. Additional direct-to-employer programs. Employers, patients, and providers' perceptions of health benefits all have an impact on access to care. Benefits design and VBC initiatives must be coordinated. A $5,000 or $10,000 deductible won't be effective, since the incentives aren't aligned if you design a VBC program that limits the patient's options while also paying a provider organization a predetermined amount per patient for a certain episode or program. While the provider is a financial risk and still needs to charge the patient $5,000 or $10,000 for some procedures, the patient is sacrificing some choice while having a high deductible. Direct-to-employer plans will accelerate as a result of these financial pressures. More accountability for costs and results will continue to be demanded by employers. Companies like Walmart and Morgan Health, a JP Chase initiative to engage in creative employer-based benefit plans and programs, are not only self-funding but are also delivering primary care services in their own facilities. In order to align health benefits with the location of care delivery, efforts will continue to be made. 4. Promote patient participation. Involving patients in their own healthcare is a crucial component of VBC. When patients have access to care and to their own health information, outcomes for providers, payers, and individuals are improved. In 2023, a key factor in the rise in patient participation will be the trend of moving healthcare out of traditional clinical settings and into the home and community. Patients who have trouble getting to the clinic or doctor's office frequently become distracted and forget to schedule appointments for standard checkups and lab testing. Healthcare providers can encourage patients to participate more actively in their care by providing care in the home or community. As a result of people's continued desire for direct contact with their doctors, the use of virtual care has decreased since the pandemic's peak. However, telehealth will continue to play a significant role in the delivery of healthcare until the year 2023 and beyond. 3. Catches on with capitulation. A provider organization may be exposed to risk as a result of the fixed monthly per capita amount paid to treat a patient under the capitation model, but it can also be a reliable source of income. Furthermore, capitated payments can enhance payer and provider financial performance by lowering the demand for a sizable internal billing department and reducing the amount of time it takes to receive reimbursed. In particular, provider organizations driven to use data to rapidly and easily uncover cost and utilization patterns will be pushed to leverage these benefits to drive an increase in capitation contracts in 2023. To an increase in spending on data digitization and interoperability. There will be more investment made in reworking the infrastructure and related business processes as the transition to value-based care and alternative payment models picks up speed. We require digitized patient journey-level analytics and data in order to achieve long-term success in value-based care. Healthcare businesses must alter their technological infrastructure and operations to overcome inertia and fully grasp the potential of VBC. This transformation needs to be made possible by artificial intelligence technologies, working with machine learning algorithms in a solid data engineering framework that permits to/from integration across systems with this digitized data. The shift to a fully digitalized offline to online patient experience benefits payers, providers, patients, and other stakeholders in the healthcare sector. It creates new opportunities for drug R&D and service delivery, lowers obstacles to care, and enhances patient outcomes. A greater emphasis on build/buy/partner investments in technological infrastructure and human capital will start to emerge in 2023, which will be necessary to ensure the success of VBC initiatives. One value-based administration should receive more attention. Value-based administration, VBA, which is crucial to data exchange and payments across a multi-stakeholder network, will come to more payers, providers, and employers' attention as they build VBC programs and networks in 2023. Accountable care organizations, ACOs, bundled payment schemes, and the Medicare Shared Savings Program are just a few examples of the many evolving shared risk reimbursement models that fall under the VBC umbrella and are required to be supported by an infrastructure for VBA. The VBC networks in 2023 must continue incorporating CBOs that can share SDO and other data, deliver services, and coordinate care, since clinicians and payers are increasingly realizing how important social determinants of health, SDO, are to health outcomes and healthcare costs. Many CBOs have limited resources and have made minimal investments in digital technology, so this will be a continuing struggle. Unfortunately, the majority of legacy systems used by payers and providers today are unable to run these kinds of programs effectively at scale. They are unable to meet the demands of quickly changing value-based payment models, while managing a complicated care network with several stakeholders playing various roles. Conclusion: as federal, state, and commercial programs continue to push for cost savings and improved health outcomes, provider revenue will be increasingly related to value-based programs in the next year. As healthcare customers want individualized attention and accessibility, alternative care delivery sites will prosper, and cutting-edge provider organizations will increase their direct-to-employer contracting efforts. Last but not least, more initiatives will be developed to match episodic models tailored to individual patients with worldwide reimbursement. So, that's it for today. We hope you enjoyed the video. Use the comments section below to tell us what you think about the video. Also, make sure to subscribe to our channel and click the bell button to be notified of all the latest videos.